Hello, my name is Dr. Scott Schmitt, and I wanted to provide a rather simple explanation of what a dental implant is. So, very simply, a dental implant is an artificial tooth root. So this is a model that shows a dental implant. It is actual shape and size. The implant itself is a metal cylinder made out of titanium, and it has threads just like a normal screw, and it again is about the size and shape of the root that it is replacing. The implant can be placed into the jawbone where your natural root used to be. This is done whenever you are numb with regular Novocaine-like anesthetic. It does not require any kind of a sedation. It is actually a rather precise procedure that typically doesn't produce a lot of post-operative swelling or discomfort. Most patients can be managed very effectively simply by taking ibuprofen, which is something, again, most people are used to taking. The implant is allowed to heal into the jawbone for approximately 4 months after that procedure, and during that time, the bone heals around the titanium and locks it in place. After that time, it is impossible to unscrew the implant. Now, on top of an implant, we typically would build a crown. So the crown is the part of the implant restoration that you see whenever it's in your mouth. It's the part that you chew with, and a crown is typically made out of porcelain. So this is an example of the crown that is on top of the implant. Now, in between the crown and the implant is a third part called the abutment. And the abutment is very simply a connecting part. So it connects the crown to the implant. So when you think about an implant tooth, there are 3 parts that you need to be aware of. The implant, which is the replacement root, the crown, which is the tooth that you chew and you see, and the abutment, that is the connecting part. So I hope that makes at least the single tooth implant a little clearer and a little easier for you to understand.